This video is going to show you how to accurately and consistently, safely, quickly measure your patient's scar mobility, which is very important for you and for your patient to see the benefits of using PT straps. Measuring the scar is very important for you, for your patient, and also for documentation reasons to know that there's benefit and progress coming along. So what I like to do is I take the superior aspect, middle, and the inferior aspect of the scar, depending on the length of the scar. If it's a really long, like a total knee replacement, then I would use all three: superior, middle, inferior. If it's a shorter scar, then I would just use superior, inferior. For this length of scar, I would just do the superior, inferior, but the technique is sound with any length of the scar. So here, I'm going to use the superior and the inferior aspect. I'm going to measure 5 different directions: inferior, superior, medial, lateral, excursion, and then the lift. Okay, so I would use my tape measure. I'm going to put the tape measure, I'm going to use 10 as the focus. There we go. So I'm going to hold, and then I'm just going to pull the skin over laterally to see how far, the very superior aspect of the scar moves, and see how it's simply pulls 2 centimeters over. All right, so from 10 to 8 to 2. So I would say that's a 2 lateral excursion, 2 centimeters. And then we're going to go medially. I'm going to pull it over and pull. You can see, let's say 1.5, a solid 1.5 centimeters for a medial excursion. So now that's our medial and lateral, and we're going to do superior, inferior. And if you don't mind, yeah, hold it right there. No. Okay. So now I'm going to pull inferiorly. Okay, pull. You can see that's a solid 1.5 centimeters for inferior glide. And I want to pull it superiorly. That definitely goes to 2 centimeters. See how quickly I can go through this and measure the excursion for all 4 very rapidly, very quickly. So that's a 2 centimeters for superior, 1.5 for inferior glide. I also like to do the lift test. The lift test is basically you're just pinching around the scar and you're lifting it up. A normal value is the whole thing pinches up, just like what you see right here. You can see the tissue. There's no dimpling, no tethering of the scar. Okay, so that is a normal. That'd be a 3 out of 3. Now, abnormal would be something like, it would look like this, where you pinch it up and it's tethered down. You can pinch it, but it's tethered down. So that would be a 2 out of 3. And if you can't even pinch it at all, that's a 1 out of 3. And that was the lowest grade on the lift test, because that's the Z plane. We got to lift that tissue up, which is really very, very important for the tissue mobility and also motion of all the joint. This is why we measure on a regular basis, so that it gives you and your patient confidence that they're benefiting from using PT straps, getting their scar moving the way they should be.